Hello, I'm Dr. Sanjay Panicker. I'm the founder of Amrita Homeopathy. We have two clinics, one is in Koramangala and the other one is at Hydrocele in Bangalore. We specialize in hair and skin problems, respiratory problems, allergies, pediatrics and infertility. I have also authored a book on pediatrics. Yesterday was the book release. This is on pediatrics drug pictures, that is, it gives an idea about how to prescribe for children, and it is an illustrated book with a lot of pictures in it so that it's easy for doctors and for others also to understand how to prescribe in pediatrics. Hydrocele is nothing but a collection of fluid around the testicles in the scrotum. So this can be congenital or it can be acquired. Congenital is seen in newborn babies. As they are born, you will see that there is a fluid collection in the scrotal area, and this usually resolves within 1 year of age by itself, is what is said. And when it persists, usually the doctors suggest for a surgery. But I have seen sometimes the doctors suggest for a surgery even earlier, which is usually not needed according to me. And even otherwise also, usually in homeopathy we treat hydrocele with medicine itself. So hydrocele is considered as a surgical disease, and if you see the textbooks of surgery, hydrocele is mentioned as the surgical condition. Usually they don't treat it with medicines unless it is related with an infection. Hydrocele can also be acquired, like if it is coming up post injury, like after an injury. I had a patient who came up with hydrocele. It can also be due to an infection. Certain infections like of the testis, like or in arthritis or epididymitis, subsequent to which fluid can accumulate and it can come up. These hydroceles can be of two varieties basically. Either it can be a communicating hydrocele or a non-communicating hydrocele. Communicating in the sense, when the child is born, when a newborn baby, the testis descend from the abdomen and come into the scrotal sac. When it comes down, there is a communication between the abdominal cavity and the scrotal sac. That's how it is. In some children it doesn't descend at all, or it gets stuck in the inguinal canal, and that can cause slow development in the child. It can cause sexual functions to get delayed. Their sperm count as they grow can be lesser. Testosterone, the testis can atrophy, leading to reduction in the testosterone, and secondary sexual characters need not appear as it happens in other children. So there are a lot of problems like that. But when this testis is descending, there is a communication between the abdominal cavity and the scrotum. So the fluid in the abdominal cavity can also be seen in the hydrocele, that is interconnected. This usually closes after a particular age. If it does not close, then sometimes even a hernia can come up. Intestine also can slip down along with the hydrocele which is there in the scrotum. When you see the hydrocele in adults, it's usually the most common reason for hydrocele in adults is subsequent to an infection. It can also be a filarial swelling which may apparently look like a hydrocele. And post injury, you can even have blood which is accumulated, hematocele, it's called hematocele, where the blood is accumulated in the scrotum. In such conditions, arnica is a wonderful remedy. Now I remember a case where a child with congenital hydrocele was brought to me when the child was about 2 years old, or 1 year 8 months or something like that, and the doctors had suggested surgery for this particular child. And we were thinking, because the first remedy that you would find in the books would be rhododendron, and when you give rhododendron left and right, you find that these hydroceles, otherwise also infantile hydro, that is in children, what you find, the congenital hydroceles, they increase and decrease as the day passes by. In the morning that's little bigger, or in the evening it's little bigger, morning it's little lesser. This kind of nature you will find in this hydrocele. For this child, after giving rhododendron, we noticed that the size of the hydrocele started increasing every time there was a rain, which is of no significance to the allopathic doctor. He does not relate the rain to the hydrocele. Even I don't know why it happens, but we have seen in rhododendron there is a symptom that it aggravates every time there is a thunderstorm. That's how it is described. And I found that this child was actually proving rhododendron. Proving in the sense, he was presenting the symptoms of rhododendron. Then after antidoting and retaking the case, I had given calcarea carb to this child. The child actually got cured of this congenital hydrocele. After treating this case for several months, then only we were able to cure this. Usually they say it goes off automatically by the age of 1. Now if I present this case to an allopathic doctor, he would definitely tell me that anyway it was supposed to go at 1 year, maybe it got postponed for a few more years. But that's not how it is. These medicines have got its effect. I have prescribed various medicines for this child, and it's only after calcare carb that this child responded, not only in his hydrocele but also his mental development, which was little slow, picked up subsequent to calcare carb. So calcare carb is one of the wonderful remedies for this hydrocele. Doesn't mean every case of hydrocele calcare carb will work. There are various other remedies like clematis, aurum metallicum and baryta carb, which can be useful in cases of hydrocele.